Good morning. Welcome to Windsor-Essex County Health Unit's media briefing for Monday, December the 20th. We are going to start with some opening remarks from our CEO, Nicole Dupuis, and then we will move into our media question. Go ahead, Nicole.
Good morning, everyone. Today, we're reporting 255 cases in Windsor-Essex from Friday. We've seen case rates of COVID-19 climbing both locally and provincially. And we want to inform everyone, due to the high volume of cases we're seeing on a daily basis, it is important for our community to continue to curb the spread of COVID-19 by reducing close contacts. We also want to keep a list want to remind people to keep a list of anyone they have had close contact with to help reduce the burden of contact tracing in the event of a positive case and to ensure that they're able to inform their close contacts. There has been a shift in case and contact management. Provincially, we'll be moving to a little less contact tracing on our end. Public health representative will connect with anyone who tests positive for COVID-19. They will be provided with information and guidance to follow. And household members of a person who tested positive are considered close contacts and will be instructed to isolate for 10 days, regardless of their vaccination status. Close contacts include anyone you're in close physical contact with, meaning less than 2 meters for about 15 minutes, without proper or consistent PPE use, including a mask. We have updated our website to ensure that information around guidance for isolation is up to date and individuals can find the information they need quickly. You go to www.wechu.org. We are at the health unit shifting again all of our resources over to vaccination. And so there will be a little more work on the part of the individual when we call. We will be calling individuals to let them know they are positive, to inform their contacts, and to ensure that their contacts know that they need to isolate and get tested. So as we move through this shift, our website will continue to be a really important resource for anyone who wants information as well. Today, officially, we've opened up our website to bookings for vaccination for all individuals who are 18 and over, who are interested in receiving a booster dose or a third dose of COVID-19 vaccination. And that's you must be at least 3 months from your second dose or 84 days. So individuals now can go to our website at wevax.ca. To book their dose if they're 18 and over. Thanks, and we'll just take questions.
Great, thank you. Any questions from CTV?
Yes, good morning. How you guys doing today? Curious, I guess over the weekend you guys announced 2 vaccination centers would possibly be opening in January. So I'm wondering if you have any more details on that.
So I don't know if I have much more details other than what is described in our statement that we released on the weekend, but we do know, as everyone across the province is ramping up to increase availability for vaccination, we wanted to ensure that there is appropriate opportunities within the county, and so we will be opening a mass vaccination site in partnership with our Town of Leamington and county officials in Leamington early in January. I don't have much more to share other than that, but certainly as we refine in our plans, we will share them, with the public and with the media.
Okay, follow up real quick too. I heard a restaurant got a ticket this weekend for $1,100 from a Ministry of Transport agent. That's another question on the side, but I guess because they failed to screen. So can you refresh me on the rules on that? Are restaurants supposed to screen people as soon as they walk in? I know they have to ask for the vaccine passport, but do they have to screen people as well?
Yep, so in the Reopening Ontario Act, screening is a requirement for restaurants, yes. So all guests should be screened for COVID-19.
Okay. All right, yeah, just checking because they were calling me going, hey, So, okay, thanks, Nicole.
Any questions from CBC?
Yes, hi, good morning. So So we're hearing that the region has run out of the rapid tests that were provided at LCBO locations. I just wanted to check in and see if that's true, and if so, when we can expect more.
So the rapid test is not a program that the local public health units are part of administering. That comes directly from the province. I don't have information to confirm if they have run out or when they, will be replenished. I do know certainly that with announcements for rapid antigen, more frequent testing in acute care and long-term care. Certainly those are probably the priority, but we wouldn't be able to speak to whether or not more tests are coming or when that may occur. It's not a program that we administer or are involved in.
Okay. I know that the booster shot bookings for those 18 and older just opened today at 8. Do you guys have any sense of numbers though? Like what bookings are looking like so far? I know we're just about 40 minutes in, but if there's any indication of that, that'd be great.
I haven't been on the site, but we did want to ensure that as I said, as we released on the weekend, we are working steadily to redeploy resources, which allows us to increase the number of appointment times available at the mass vaccination site. So, incrementally, we'll be opening more and more appointments, but we did release additional appointments over the weekend, and as well, we'll be opening up additional spots starting tomorrow for the rest of the week. So we're close to around 3,000 individuals a day that can be vaccinated in our mass vaccination site.
Okay. Are they booked up just yet for today or for the week? Do you have a sense of whether you're booked or not?
As I said, we added some additional spots. So I know we were pretty full, but we did add additional spots. I can't tell you right now. It's Monday morning, so I can't tell you if those have already been booked up. People are pretty quick on the website, so I'm sure they'll go quickly, but we will continue to open up more spots as well. Just a reminder to everyone that healthcare providers are on board and vaccinating as well. So you can go to our website at www.wechu.org and see which primary care providers are vaccinating as well. Pharmacies, are well equipped to provide third doses. So there's lots of options outside of just the mass vaccination site as well that people can take advantage of.
That's great. Thanks so much, Nicole.
Yeah, you're welcome.
And any questions from Blackburn?
I just wanted to ask, and maybe you don't know yet, do you know where these new mass vaccination clinics in West Windsor and in Leamington will open? Will it be at the Nature Fresh Recreational Complex again, or?
So we are looking at that as an option. And again, we'll be able to solidify and provide more details later this week. And so again, the target for both West Windsor and Leamington is the beginning of January. So that first week of January, is when we think we'll be ready, and we'll certainly add a few hundred spots a day for folks within those two areas, which will be great. They're two priority areas for sure.
Thank you.
Any questions from Windsor Star?
Yes, good morning. You talked about how contact tracing will see some changes. Can you trust individuals to inform their close contacts when they've been exposed?
I would hope so, but even right now, prior to this shift, and we did see this last year actually, where we would get to a point. Last year we had a large number of cases around the holidays, and we did make calls to individuals, let them know they were positive and ask them to inform their close contacts. The difference was we were, trying to or attempting to follow up with close contacts last year, but we weren't always able to get to them in the amount of cases we had last year. Again, even right now, if we were to call and ask for the case list of contacts, it is up to the individual to provide the correct information and accurate information to the public health unit to follow up. The biggest difference now is that instead of us calling those individuals and you providing us a list, we'll be asking individuals who are positive to contact their contacts themselves. And in fact, we do advise people do that now, even though they will receive a call, certainly, I'm sure, I would rather let my, friends know or my close contacts know prior to them receiving a call from public health. So, I hope that everybody certainly is honest and forthcoming and is ensuring that they're letting their contacts know if they're positive and, giving them the appropriate instruction. And certainly our website will be available. And if individuals have questions, they can always call us and ask. We'll still be available for answering questions through our main hotline.
So if I could just supplement that,
Yeah.
Case and contact management is the cornerstone of containment. And the reason we've had to make this shift away from our traditional form of case and contact management to this different form of case and contact management is because we want to shift our resources to focus on vaccination. Case and contact management is still important, and containment is still important. Containment is probably one effective strategy to prevent COVID from being transmitted from one person to another, and particularly being transmitted to a person who's not currently vaccinated. So we encourage people to follow the case and contact management paradigm so that we can try to contain COVID as best as we can.
Thank you for that.
Any questions from AM 800?
Nicole, going back to Bob's question about enforcement, was the health unit part of that enforcement blitz this past weekend?
We're always part of enforcement blitzes. So yes, we always partner with our, and many of the provincial blitzes, usually they do work and coordinate with the health unit. Sometimes it's at our request that we're working together across enforcement ministries. So you mentioned transportation, but also Ministry of Finance, Ministry of Labor. There's a number of agencies that have enforcement officers that can participate and certainly enforce provincial requirements. But yes, we're always involved, and our folks are out every weekend.
I know it's Monday morning. Any idea how this past weekend's blitz went?
I don't have, I haven't even had a chance to review up the summary, but we could probably give a better update certainly on Wednesday.
And then you talked about shifting resources. I've asked you this question. My colleagues have asked this question before as well, but just in regards to staff and staffing levels, I guess maybe two questions here. How is the staff doing? And when it comes to other health unit programs, will they be impacted as well?
Yeah, other health unit programs have been impacted for almost 2 years now. Certainly with the shift, and that call to action, all hands on deck for vaccination right now, it will impact even some of the programs that we have, continue to maintain, or we're just starting to ramp up. We're doing our best, to keep certain critical programs running. Our health department, for example, is a priority, and we'll continue to try to keep that as a priority as we move forward, knowing that, especially with the seniors program, we are the only resource for that program right now. But yeah, all of these changes certainly have an impact on the other public health priorities that we have. And I think the staff are doing well. They're a great team, and we're doing our best internally to ensure that individuals get the little bit of time that they need so that they can start fresh in the new year as well. Because it's a bit of a race again against time. But yeah, hopefully that answered your question.
Yes, for sure. Thank you very much.
We do have time for one follow-up question per outlet. So we will start with CTV with any follow-up.
Yeah, just we'll keep on the booster part here. I know it's going to become a big push in the next few months, but how important will it be? Because I know there's going to be a lot of people on the fence who are going, well, I got my first two, but do I really need the booster? So how important and how vital is this booster? And is it going to be part of the vaccination passport at some point, do you feel?
Well, the booster is important. We know that there is some level of waning immunity. And if you get the booster, you're less likely to get COVID. And if you do get COVID, the belief is that when you're immunized, that you're less likely to have severe disease. I encourage everyone who's eligible for the booster to get the booster. You know, one contextual item is there has been an adjustment, and the third doses for people over 30 will be Moderna preferentially. But we would really encourage people to get their boosters. And we're trying our very best at the health service to provide access to boosters through a variety of mechanisms, including mass vaccination centers, pharmacies, and physicians' offices.
Okay, thank you.
Follow-up question from CBC.
Yes, this is actually related to the safe injection site or the safe consumption site. I know it was expected to go to council today, but it's no longer on the agenda. I'm just wondering if there's any updates on where it stands location-wise or anything, any updates in terms of it.
Yeah, thanks for the question. Correct, we had hoped to originally go in November, and we're moved to December today's date, and then we're informed that there wasn't enough room on the agenda, and we have been moved to January's agenda. So certainly our our team internally, as well, working with our community partners, are preparing, and behind the scenes we're continuing to complete and have ready the application so that once we seek and get approval from the City of Windsor for the site, which continues to be at on Goyou, 628 Goyou, that we'll be able to submit right away. We know there's a little bit of a waiting, certainly once we submit the federal and provincial applications, but we do need that approval from the City of Windsor. So we're very hopeful that we won't, that we'll be able to do so in January, but we have been moved from the agenda.
So if I could just supplement that, the Public Health Service's role is to advocate for things that aren't always popular. But I think it's really important to recognize that about 2,500 people died of opioid overdoses. It's many times more than the people who died in car crashes. Having the safe consumption site is one part of an effective strategy to mitigate the opioid crisis. Sometimes the opioid crisis gets less emphasis because of COVID, but it's still going on. This is an important item for the people who live in Windsor-Essex. The people who died of opioid overdoses are many times they're people just like everyone else, and I think that it's incumbent on all of us to get the safe consumption site up and going so that we can further try to address the opioid crisis.
Thank you.
Follow-up question from Blackburn.
Just to clarify, that 2,500 people, that's across Ontario, and in what time frame?
We can, if you send us an email, we'll give you the exact data. It's on the public website. And we can give you the exact number over the 12-month period, but it is across Ontario.
Okay, thank you.
Follow-up question from Windsor Star.
Yes, we know that there's a mad dash for boosters right now. Eligibility just opened up to so many more people. So need people panic if they can't get their third dose right away?
Well, I don't think there's any reason to panic. I think that what we have to do is to have a rational and ordered approach to managing the pandemic. Clearly, the people who are at most risk from experiencing adverse events to COVID-19 are unvaccinated people, and people that are unvaccinated, I really encourage them to go get the vaccine. About 2/3 of the deaths are in unvaccinated people. People that are older are more likely to suffer the adverse consequences of COVID-19, and those people should make a real emphasis to get their third booster shot. The other group of people I think that should really get the vaccine are those people who have chronic medical problems. So if someone has a kidney transplant or a liver transplant, or previously treated cancer, or has lymphoma, or as type 1 diabetes, those people should get the third dose of the vaccine as well, because the other group of people that are getting hospitalized and dying from COVID are the chronically ill vaccinated, and we're trying to give the booster injection to improve protection for those people as well. But I don't think there's any reason to panic. I think there is vaccine availability, and it's distributed through multiple channels. The Public Health Service is working to try to improve accessibility even further. I'm hopeful that more family doctors will also be part of the distribution chain, and we're trying to work with them to encourage that as well.
If I can just add, we don't want people to panic. We want to express some sense of urgency, certainly. And, we encourage everyone to make an appointment and get their first. And to, sign up for their first available appointment. But also, we really do ask for some patience. I think everyone can remember the process we went through before for first and second doses, and it was a bit of a longer, where we had different sections or of the population open at different times, and we are opening it up for 18 and over all at once. So certainly it's a little bit of a different experience, but as Dr. Musafiri said, we are every day increasing opportunities for vaccination, and we again don't want people to panic. Just continue to follow public health measures and public health advice, and do all the things that we've been sort of speaking to for the past 2 years to keep yourself and your family and your community safe. But definitely, take that first available appointment that you can, and get your third dose booked, and there will be plenty of opportunities.
Thank you both.
Yeah, and not to belabor this point, one of the things to think about is that we are offering Moderna preferentially for people over 30. If you had Pfizer for your first 2 doses, getting Moderna as your third dose is a perfectly good option. And the whole goal is to improve immunity. So I wouldn't let the fact that you're getting Pfizer as the third, getting Moderna as your third dose should not be concerning. And it's more important to get the booster as soon as you're eligible for it.
Thank you.
And a follow-up question from AM 800.
Doctor, just in regards to the current case counts in our area, like Nicole mentioned, 255 today over a 3-day period since Friday. Last Monday, I think it was 263. I know school wrapped up on Friday for the holidays, and I know you always say can't predict the future, but with the holiday season approaching, the holiday weeks here, and I guess with school ending, are you worried that those numbers could climb up more? I know obviously the province is saying the numbers are going to climb, but here in Windsor-Essex, what's your gut feeling?
Well, we're always concerned about case counts and the potential for rise. I think that's the reason why we had recommended people restrict certain activities and to take precautions, and that includes not having gatherings beyond 10 indoors, 25 outdoors, as well as reduction in restaurant capacity. I think we just have to monitor the situation and see what the effect is. Obviously, the holidays are a time of potentially heightened transmission, but I'm hopeful also that these public health measures and vaccinations will attenuate that. And it's still wait and see, unfortunately, see what will happen after the holidays.
Thank you.
Thank you very much, everybody. That will wrap up our meeting for today. We will meet again on Wednesday, December 22nd. Have a wonderful Monday.
Good day.
All the best. Bye-bye.